The causes of dystocias can be divided into two main categories: dystocias, which are originated by pathology in the cows, and dystocias originated by a problem with the fetus. The cause of dystocias originated by a pathology in the mother can be further classified in two categories. Dystocias can be due to a failure in the expulsion of the fetus due to a pathology or dysfunction of the uterus, or they can be caused by the obstruction of the pelvic canal. Within the uterine pathology, one can distinguish various causes of dystocias. The first one would be primary uterine inertia, which can be defined as a decrease in the myometrium's potential to contract without having there an obstruction. The most common cause of this problem is hypocalcemia. However, other causes count hormonal disequilibrium, lesion of the region and its innervation, or hydroallantoid, which is the excessive dilation of the uterus, which extends to 100 to 200 liters, whereas it should only contain 8 to 12 liters at this point of its gestation. The diagnosis of primary uterine inertia can be done if the second phase of parturition does not progress and the fetus does not enter the pelvis despite the dilation of the cervix and the correct fetal position. To attend a cow that is suffering from primary inertia due to hypocalcemia, you should first administer calcium. Then, you should put the calf in the right position and do a forced extraction. The second uterine problem, which can cause a failure in the expulsion of the fetus, is secondary uterine inertia. This can be defined as the failure of the myometrium to contract due to an obstruction. It is the most frequent cause of dystocia related to mothers and can cause a placental retention and metritis. Normally, the obstruction of the myometrium is due to a uterine torsion. A uterine torsion is the rotation of the uterus 45 to 720 degrees. It can be precervical, in which case the diagnosis can be done by a rectal palpation, or postcervical, which is the more common and can only be diagnosed by vaginal palpation. But what exactly happens in a uterine torsion? Well, the parturition canal is simply closed by the uterus itself that turns around itself. The calf cannot exit the parturition canal and is blocked cranial to the torsion. The main causes for this condition are the anatomy of the cow itself. There's a decrease in the size of the ligament which maintains the uterus in place. The number of previous parturition, torsion normally appear 15% more in cows that have already given birth in the past. Fetal movement during the beginning of the parturition, sex and weight of the fetus is more likely for there to be a uterine torsion in gestation of males that weigh more than 48 to 50 kilos, the end of the gestation, and the geographical region with mountains. The main clinical signs to diagnose these conditions are pain, digestive symptoms, increase in the cardiac and respiratory frequency, and the absence of evolution of the first phase of parturition. The prognosis of this condition depends on the level of ischemia of the affected region. There's two ways to resolve a uterine torsion. The first way is to perform a left pericostal laparotomy to resolve the torsion and finish giving birth by the vagina. The second method is to do a laparotomy and a complete cesarean C-section. The second category of cause of dystocias due to the mother is the obstruction of the pelvic canal. This obstruction can originate from bones in case the pelvis is too small or the cow has suffered a pelvic fracture previously. In this case, the resolution can be done by mutation and forced extraction or surgery. Another cause of obstruction can be soft tissue of the region due to fibrosis, neoplasias, or scars. In this case, manual dilation of the soft tissue and lubrification can help the resolution of the dystocias, or the vet can perform an episiotomy or cesarean C-section. And now, what are the causes of dystocias related to the calf? Well, first of all, there can be a disproportion between the size of the calf and the size of the pelvis of the mother. This is the main cause of dystocias in meat cows, like Belgian blue breeds. The main factor which determines the size of the pelvis of the mother are the age of the cow, its breed, and its weight. The main factors that affect the size of the calf are the breed of the father, the number of gestation of the mother, it's more common in multiple parturition. The sex of the fetus, it's more common in male calves. The nutrition of the cow, it's more common for obese cows to have bigger calves. The transverse presentation of the fetus and the duration of the gestation. In case the calf is too big to pass through the pelvic canal, the dystocias will require surgical treatment. Another cause of disproportion between the size of the calf and the pelvic canal can be congenital disorders or twin birth. The second category of cause of dystocias due to calves is wrong disposition of the fetus in the pelvic canal. Its presentation, position, or posture is not physiological. This cause of dystocias occurs in more than 25% of dystocias and in more than 5% of births.